Good morning, welcome to Breakfast with Naga Manchetti and Charlie State.
Our headlines today: the first weekend of relaxed restrictions in England, but tourist hotspots are warning day trippers to stay away.
Yes, it may be very tempting, but we're being urged to think twice before coming to places like this. After England's lockdown rules were relaxed earlier this week, there are fears that the country's beauty spots could be overwhelmed this weekend. I'll be asking local residents why they're concerned.
Stop squabbling. The England Children's Commissioner's message to teaching unions and the government over plans for primary pupils to return to the classroom.
Many of us would have been watching Eurovision tonight, but it's not going to be. So we are going to talk to the man who would have been representing the UK in Rotterdam.
Good morning. Clubs in League Two vote to end their season early due to coronavirus pandemic, while the Scottish Premiership is expected to do the same next week.
Good morning. Well, for most of us, it's a cloudy start to the day. For England and Wales, it will brighten up, a bit of sunshine coming through, but in Scotland and Northern Ireland, staying quite cloudy today, and there will be a little bit of rain to come for some of us as well. I'll have the full forecast coming up a little bit later on.
Good morning. It is Saturday, May the 16th. Our top story is stick with the rules, don't take risks. That's the message from the Health Secretary, Matt Hancock, as we enter our first weekend since the lockdown restrictions in England were eased.
Local councils are warning us to stay away from beauty spots and beaches, fearing a surge of visitors will lead to an increase in infections. Comes after scientists revealed the infection rate across the UK has risen. John McManus has the story.
In Southwold in Suffolk, they're hoping for visitors this weekend, so long as they follow the distancing rules. They don't want to see a repeat of these scenes from March. With warm weather on the way and the resumption of travel in England, resorts across the country are worried that day trippers may bring more than just their suntan lotion. But ministers in London say they trust the public's common sense.
This weekend, with the good weather and the new rules, I hope people can enjoy being outside, but please stick with the rules, keep an eye on your family and don't take risks.
Meanwhile, there's been another 384 deaths from Covid-19 across the country, bringing the total to nearly 34,000. The travel ban remains in force outside England, and the Welsh and Scottish governments have already warned tourists to stay away. Bosses in Cornwall and Devon have joined them, urging visitors to give their beaches and beauty spots a miss. And it's a similar message from Brighton to Whitby. And the authorities in Scarborough are not just worried about the virus. They pointed out there will be no lifeguards on their beaches, or indeed on any across the UK. And there's a worrying development. The overall rate of infection has crept up to between 0.7 and 1. If it goes above 1, it means the virus begins to spread again. There are geographical variations. London has a lower rate than Wales and Northern Ireland, and it's thought the uptick may be down to hospitals and care homes rather than the wider community. This weekend, the RAC says it expects 15 million leisure journeys to be made by car. But if there's a further rise in the infection rate, the brakes may come on again in the next few weeks. John McManus, BBC News.
Well, police in Wales are reminding people to stay home this weekend as restrictions are still in place there. They're also making it clear that people should not cross the border to visit beauty spots in Wales.
The Chief Constable of North Wales Police has been talking to us on this programme in the last hour. We asked him what officers will do if they see people breaking the rules.
Our approach hasn't changed. So would I expect my officers to stop that vehicle? Yes, I would. Would I expect them to understand why those individuals are travelling, where they're going to, what the purpose of their journey to? Absolutely. And if it's not within the law in Wales, i.e. the travel rules that we've got here or the exercise rules, I would expect them in most circumstances to turn them round back towards where they've come from, and only then use enforcement if they need to. And we've done that consistently through the last 7 weeks. And the feedback we've got is we seem to have got the message and the balance really well.
The Children's Commissioner for England has told ministers and unions to stop squabbling over plans for pupils to return to school next month. Let's get more now from our political correspondent, Jessica Parker. Very good morning to you, Jessica. There was an important meeting, wasn't there, yesterday between unions and scientists to talk about whether any of their questions about the safety of reopening schools at the beginning of June could be answered. Where have we got to today?
Well, as you say, there was that meeting yesterday, unions emerging, those saying that actually they still had some more questions than answers, in fact. And it seems to me what Anne Longfield, the Children's Commissioner, and she's appointed to sort of stand up for the rights of children, is trying to do today is bang heads together, telling the government, telling unions to stop squabbling and put the needs of children first. Now, this all, of course, began when Boris Johnson set out his roadmap last weekend, including this idea of a staggered return for some primary school children from June the 1st. And the government set out guidelines such as limiting class sizes, not mixing groups, more work outdoors, lots of cleaning, staggered break times to try and make the school environment safe. But unions were saying they still had some serious safety concerns, and that's what yesterday's meeting was all about. But you find different opinions on this matter, and of course we're just a couple of weeks away from June the 1st, but BBC Breakfast has been speaking to the Mayor of Middlesbrough this morning, who's saying he thinks kids do need to get back to school as soon as possible.
In the last 8 weeks, during lockdown, the gap between rich and poor kids is ballooning, and we need to act. We need to act fast. We need to do every single thing we can to get all kids, but especially deprived kids, into school where they can learn, be fed, be looked after, and develop their language skills and their social skills.
Now, I think that there is a consensus around the fact that if and when schools do return, everybody wants it to be safe as possible. Something Anne Longfield, the Children's Commissioner, has been saying, for example, she thinks there needs to be rigorous testing of teachers, children and families. But she's also saying that you can't entirely eliminate the risk. It's all about controlling the risk. I think where this is going, there are going to have to be many more conversations between the government, between unions, between teachers as well. As I say, just a couple of weeks away from that early June date. But I think some consensus this morning trying to move ahead. I listened to an interview with one of the leading unions a few moments ago saying that they were willing to try and see if it would be possible to reopen schools by June the 1st.
Jessica, thank you.
Almost half of patients severely ill with coronavirus are also developing dangerous blood clots. Specialists at London's King's College Hospital have told the BBC that the virus is changing the blood in the worst affected patients, increasing the risk of fatal heart attacks and strokes.
Now, just a few weeks after Captain Tom Moore hit the top of the charts, another centenarian has become a record breaker. It is Dame Vera Lynn, who has become the oldest artist to have a top 40 album in the UK. The 103-year-old saw her greatest hits album re-enter the chart at number 30, boosted, of course, by last week's 75th anniversary of VE Day. What an extraordinary achievement. 103 years old and in the charts.
Download the BBC News app now and get the latest headlines as they happen. Personalise your app to learn more about the stories you care about and watch BBC News live wherever you are. Stay up to date, whatever you're up to. Download the BBC News app.
The easing of restrictions about where you can travel in England, different in different parts of the UK, of course. Concerns about how many people will travel to beauty spots. Lake District, one of those. Adam McLean has been there. Here's his report.
It's the most popular national park in the country. And one of the outdoor spaces mentioned as a place for exercise by the Prime Minister.
This is about allowing people the pleasure and the exercise of going to places, to parks, to places, to national parks, places of outstanding beauty and taking advantage of the open air.
But those who normally welcome visitors here are asking people to stay away.
Our responsibility is to the people in Cumbria, and I understand the national dynamic of wanting to get the country back to normal, but really we have to think about the safety and the well-being of our local communities, and that's why we're asking people, please don't come at the moment, please put off your trip to a better time.
In this part of the country, there is a fourth emergency service, often as busy as the police, ambulance and fire crews. Mountain rescue teams here say they're worried about the number of people it takes to rescue someone from high on the mountains, a place where crowds can be avoided, but other risks remain the same.
Patrick Motherby from Patrick Base, you receiving over?
Patrick Base, yeah, receiving you loud and clear here, over.
There are about 400 volunteers in the Lake District. in the various different rescue teams, and about 80 of those are police officers, doctors, paramedics, nurses, are working in the emergency services, and we really need to protect them so that they can continue to do their day job. So our basic PPE kit, everybody already has goggles, so we've got additional goggles for team members if anyone's forgotten those, or indeed other members of the public might be nearby.
As with almost every job, the way of working has changed, and the team here at Patterdale Mountain Rescue have all been told to avoid England's highest peaks when not on a call-out.
I desperately want to get to Scotland and go and enjoy myself. I desperately want to get back onto the high fells and go to the summit of Helvellyn. So we genuinely are just appealing to people's common sense and kind of help us to kind of maintain, that low level of rescues. The mountains will be here when Covid-19 passes.
John Atkinson owns a farm by Coniston Water. He had problems with people trying to camp during lockdown.
So we've had a few issues before the announcement that, in effect we were open. And I think, from my point of view, I think we need to just be careful and go steady. What we don't want is a second wave and, we're shut up till Christmas and we're still talking about this in the new year. If people can just restrain a little bit and wait for things to get a bit better.
There are 425 COVID cases for every 100,000 people in Cumbria. It is one of the highest infection rates in the country, and with more than 20 million people visiting the Lake District each year, there is concern among the 40,000 people that live here.
Don't rush to come back right now. I think people need to recognise that we have a small local population here in the Lake District in Cumbria, a high incident of the Covid-19 disease, and the potential, because the Lake District is so popular, for an awful lot of people to come back to the same place. And that's risky for our communities and it's risky for our visitors.
The Park Authority are adding social distancing signage to their car parks, and those in hospitality are preparing for their new normal.
We're all going to have to look at what we do, almost reinvent ourselves for a new experience which is appropriate for distancing and for the way people are going to be behaving from now on. The visitor economy and tourism businesses are raring to go to be welcoming visitors back when the time is right. And the time's very close. I don't think we're that far off. But it needs to be right and it needs to be done properly.
Lib Dem MP Tim Farron has written an open letter to the government. He's calling on them to rethink the new rules.
We in the Lakes are very, very welcoming people. We want you to visit. We recognise, not just because it's good for our economy, but actually because that's why the Lakes exist. We're a national park. This is not us, with pitchforks and flaming torches saying, get off our land. This is instead us caring about you. We don't want you to catch the disease, and indeed about our older and more vulnerable people who live here. We don't want them to catch it either. This is too soon. The government should have set a distance limit to allow people to exercise, but not allow them all to come to Britain's most popular national park.
It goes against everything tourism boards stand for, but the message from those in the Lake District is clear: to stay away for now. The lakes and mountains will be here long after this pandemic. Adam McLean, BBC News.
Well, some beautiful images there, but alongside that comes lots of questions, and we've got the perfect man to answer some of those questions. Dr. Chris Smith, virologist. Good morning to you, Chris. We've spoken many times before, and I'm going to start. People love practical, useful information. So we're looking at those pictures. I see a bench looking out over a beautiful place. There are real concerns. Too many people will go there. Question on a park bench. What are the chances of catching coronavirus if I sit on a park bench or one of those beautiful places just after someone who's had the virus?
Well, if they've left virus on the bench and you touch the bench and then you touch your eyes, your nose, or your mouth, you could transfer virus from the bench to a part of your body that will get you infected. But if you do what we're all being advised to do, which is to wash your hands regularly and avoid touching your eyes, nose and mouth, then your risk is really low, because any virus they'll have left in the air around the bench will have been blown away on the wind in no time. And also, because the bench is outside, it's hopefully in the sunshine, it's going to dry out any virus that's on the surface. The sun will deactivate it, the warm temperature will deactivate it quite quickly. Any rain that does fall will wash it away. So the time that the bench remains infectious is going to be really very short. But if you literally sit down right after somebody else and they have put virus on the bench, you should be protected by washing your hands, and that's the best piece of advice. Don't touch surfaces and then forget to wash your hands to the greatest extent you can.
So more people, and it's across the UK, but different in different parts of the UK, have more access to the outdoors now. A lot of people asking the question, and we've heard some from the scientists about the difference between how well the virus can transmit outdoors as compared with indoors. So what are the differences?
Well, how does it transmit? It transmits chiefly as droplets. So when you breathe, cough, sneeze, or just talk to someone, you're spraying out respiratory droplets. These are tiny particles of water from the airways, and because the virus grows in the airways, you end up with virus effectively pre-packaged in these droplets. And they hover in the air around you for a period of time. It varies from minutes to hours, depending upon the arrangement of a room, for example. And then another person can come along, breathe in those droplets, and you need to breathe in about 20 and maybe as high as 1,000 virus particles to catch this thing. But that's not actually that hard to do, because a person just breathing is probably breathing out up to 50 virus particles a minute. Now, if you're outside, on the other hand, the likelihood of those droplets staying around for any appreciable amount of time is really low. So they're just going to blow away or fall to the ground, and then they'll get trodden underfoot. So outside, the risk is really low. Inside, it's a different story.
And if people are outdoors and they're looking at weather conditions, do they have any bearing on it? I'm thinking particularly of wind or rain, any condition. I know you've already said the danger is low, but does that make a difference?
Well, when you go outside, the conditions are completely different from inside, because inside the air is being changed much less frequently, obviously. And when you're outside, the wind is blowing virus away. So the chances of you breathing in particles that someone has shed from their body, because they don't survive in the environment for very long, is much lower. So outside is much better to be than inside on the whole.
Let's talk about the R rate, which is something we've all come to know a little bit more about. There is concern that there has been a slight increase in the R rate across the UK. Can you just talk us through those numbers and why they're so significant, and what we know about why it may have gone up again?
Well, the R rate is the reproductive index of the virus. And put really simply, this is, for every case you have, how many people do they give it to? And so if you've got a situation where each case is giving it to more than one case, then there must be more cases of the virus in the population. And if it's growing with more people giving it to more people than had it before, the numbers must be increasing, and therefore the rate at which it's going to spread is going to increase. And that's going to lead to a peak or a big surge. On the other hand, if the number is less than one, in other words, each person is giving it to fewer people than currently have it, then the amount of virus in the population must shrink. If it sits at one, it means there's roughly a status quo. You've got the same number of cases just replacing themselves as each person recovers but gives it to another person. So it will vary according to how you actually ask the question. If you ask the question in certain parts of the country, you will get a different answer for R than others. And this is because the country is not homogeneous. It's not the same right across the country. There were hotspots where lots of people had it originally. There were other areas of the country where very few people had it. That means that areas like London, where we think now on the basis of antibody tests, perhaps 10% of the population have had the virus, what that means is that there are now fewer people to catch it. There's a bit of immunity in the population, so the trajectory of spread in London now is probably going to be lower than, say, another part of the country where initially there were fewer cases, but now more susceptible people. So when the virus does go to those places, it's going to have an easier time spreading. The numbers that are being reported are largely being reported across the country as a whole, so they're an average, and they're also going to be quite skewed by places like hospitals and care homes, where we're seeing more spread than we are in the community. So it's not a given that because the number is going up, or the number says something, that that's representative of everywhere all the time. The numbers are also chiefly based on historical data, because obviously it takes time to collect the information and then make the calculations. the numbers that they're using are often death rates because they're very hard to argue with. If someone's died of coronavirus and you know that you can rely on those figures. But of course, it takes 3 or 4 weeks from a person becoming infected to a person becoming sufficiently ill that they might die, and therefore the numbers are being reported with a 1-month lag. So these R numbers we're seeing do have a lag built into them, and we also have to take that into account.
Dr. Chris Smith, thank you very much. You're very helpful for all of us in seeing through some of the sciences as you're explaining. Thank you very much.
See the headlines as they happen and watch BBC News live in the app and get the full story with bbc.co.uk/news. Follow the story for all the latest with BBC News.